Chapter is chapter number 198 about iron toxicity. Iron supplements are widely available and mostly used by the pregnant woman and women of childbearing age. So it is possible that the babies will also eat them, small toddlers, etc. They are at risk of intentional overdose due to impact of maternal stress, and sometimes they are like in jams and candies form, so babies can eat them. All preparation containing more than 30 milligram of elemental iron distributed only in blister packs, not as a syrup. And implementation of mandated warning labels is also there. What does excess iron do? Excess iron saturates body's mechanism for iron homeostasis, leading to more free iron, causing ultimate organ toxicity. The overall bioavailability of iron is less. It is stored by in ferritin and transported by hemoglobin, myoglobin, cytochrome and other enzymes. The bioavailability is about 5% for Fe+3 forms and 15% for Fe+2 forms. It is chelated to heme moiety. Ferrous iron is transported to the GI tract, oxidized to ferric, and then it is transported via transferrin taxi. Fe+2 से +3 बनेगा, फिर वो टैक्सी में बैठ जाएगा. Transferrin is generally 2 to 3 times the normal serum iron concentration. The serum total iron binding capacity TIBC assess primarily the amount of serum transferrin, and it is 2 to 3 times the normal serum iron concentration, which is 50 to 170 microgram per deciliter. Iron is stored within the body in form of ferritin, and it's a protein. It can bind to 4500 molecules of iron. In adult, about 0.5 to 1 gram elemental iron is stored as ferritin and hemosiderin, primarily in the bone marrow, spleen and liver, and it is mobilized when iron deficiency is there. Iron is a potent catalyst for production of oxidants like free radicals, so it irritates GI tract, causing vomiting, diarrhea, abdominal pain, mucosal ulcer, bleeding after a significant ingestion. As the mucosal surface is injured, the barrier is compromised and free iron can pass in the blood. It disrupts cellular processes, induces acidosis and organ toxicity. Elevated lactate and metabolic acidosis is there. Oxidative phosphorylation is inhibited due to inhibition of mitochondrial electron transport chain. Due to toxic radicals, they inhibit the ETS. Membrane lipid peroxidation is induced, so cell death is there. And portal blood supply delivers a large amount of iron to the blood, leading to hepatotoxicity and acute liver failure, iron induced. Myocardial and vascular dysfunction is also there because iron deposits there. Negative inotropic effect and direct myocardial iron deposition. So iron formulation and elemental iron are in 3 forms: ionic, non-ionic and chelated. The ionic are your ferrous fumarate, sulfate, gluconate and citrate. The non-ionic are your carbonyl iron, iron polysaccharide, iron dextran. The chelated are bisglycinate and glycinate. The toxicity: the amount of ingested elemental iron in toxic form correlate with the potential for toxicity. Moderate toxicity occur at doses of 20 to 60 mg per kg of elemental iron, and severe toxicity occurs more than 60 mg per kg ingestion of elemental iron. So moderate toxicity occur at 20 to 60 mg per kg ingestion. And severe toxicity, more than 60 mg per kg of severe toxicity can be expected following ingestion of more than 60 mg per kg of elemental iron. The chelated sources of supplemental iron are less toxic than non-chelated iron. Chelated is less toxic, non-chelated more toxic. Carbonyl iron does not participate in redox reaction, so it is much safer. So ionic non-chelated are more dangerous compared to the ionic non-ionic chelated में non-ionic chelated safe है, ionic is dangerous.